The surge in COVID-19 cases in Puerto Rico, led by the contagious Delta variant, is leading to a concerning rise in the number of intensive care hospitalizations and death. Our Christian Ramos has more from Puerto Rico.
The Delta variant of COVID-19, which is more lethal and contagious, continues to spread here in Puerto Rico, and now more people are ending in the ICU, including children, a very concerning scenario for the local medical sector.
I'm concerned that there are many patients that are being admitted in critical condition. I don't know if it's because the Delta variant is much more aggressive and more virulent. It is definitely a large number.
273 deaths triggered by COVID-19 were reported in August, the highest monthly rate in all the pandemic. From those, almost 250 of the disease were not vaccinated.
The vast majority of the persons that are getting infected and ending up in the hospital is mostly made up by people who are not vaccinated. It's like 85% of the people that are admitted to the hospital right now are persons that have never been vaccinated or have been vaccinated with only one dose. I need to say and make this very clear. The chances that you will end up in the hospital if you're vaccinated, even with the Delta variant, is much smaller than if you're not vaccinated. And the numbers are very clear regarding that. It's like 85% of the cases that are hospitalized right now in Puerto Rico, even with the Delta variant, is like 15% if you're vaccinated versus 85% if you're not vaccinated.
Cabanillas also explained that with the Delta variant, pediatric cases are increasing and hospitals have more children in intensive care.
There are more children now in the hospital and there were months ago before the Delta variant. Whether they are becoming more sick or no, I think they are. Because it would be extremely unusual for children to end up in the ICU. We have 28 cases right now in the whole island that are admitted to the hospital, much more than there were like 2 months ago when the number was like 12 to 15 on.
According to the CDC, Puerto Rico has now a very high risk of infection, but Cabanillas assured that with the vaccination rate going up, the cases and mortalities will decrease. Reporting from San Juan, Puerto Rico, Christian Ramos.
All right, thanks, Christian. In the meantime, the hunger crisis in Haiti is growing in the wake of the devastating earthquake earlier this month. Last week, people were seen looting a food truck in northwestern Haiti, the hardest hit area. The World Food Program says the number of people in urgent need of food there has increased by a third since August 14th, when the quake occurred. The earthquake destroyed crops and livestock and leveled markets, making Haiti's already desperate situation even worse. A tent encampment in the mountains, hundreds of villagers took shelter after their homes were destroyed in the quake. A single fire-charred corn cob was the only food in sight. Haiti, the poorest country in the Americas, has long had one of the world's highest levels of food insecurity. In September, the United Nations said 42% of the population faced acute food insecurity. And a surge in COVID-19 cases affecting more children in Barbados has resulted in the decision to have all classes fully online once the school's term starts on September 20th. The increase in cases has been linked to the highly contagious Delta variant. Last Friday, health officials began administering the Pfizer vaccine to children ages 18 to 21. As of Monday night, 2,100 out of the island's 21,000 students had been vaccinated. But Education Minister Cynthia Bradshaw disclosed at a press conference on Tuesday that more than 100 school-aged children are also in COVID-19 isolation facilities across the island. And 2 schools so far are being used as isolation centers, with the possibility that more could be added.
As a consequence, we believe, and after discussions this morning with the various representatives of the trade union movement as well as the PTAs, we believe that the time has now come for us, as we approach the start of the September term, to go fully online. And therefore, I want to announce that all classes will begin for both students at the public and private schools on the 20th of September, but they will now be fully online.
Sorry. And Bradshaw added that given the stresses which students, teachers, and parents have endured over the last year and a half, the ministry will be providing mental health and wellness support.
The Mental Health and Wellness Committee, which was established a few months ago, has been up and running. The senior psychologist, Juanita Brathwaite Warren, in my ministry, has been working and heading that team, and they've been working together with the guidance counselors. They've been working with the social workers. They've been working with the primary school counselors, and they've been working with our safety officers to ensure that when our students return, whether in an online way or whether in a face-to-face way, that we're able to have the necessary support systems in place to be able to address any of the challenges that they may face. And I want to assure the public that we are well aware of the difficulties that our students are facing, but equally we are also well aware of the challenges that some of our teachers have been having as well in coping in the online environment.
And 2 senior leaders in the U.S. Food and Drug Administration's Vaccine Review Office will soon be stepping down. The director of the Office in Vaccine and Research and Review will retire on October 31st, as well as the deputy director of the office in November. Now, there's no word yet on why they're leaving. The news comes as the FDA works towards the high-profile decisions, including COVID-19 vaccine approvals, authorizations for younger children, and booster shots. And as COVID-19 cases surge across the U.S. mainland, especially among unvaccinated Americans, hospitals are being pushed to their limits. 5 states are nearly out of ICU beds. Meanwhile, a new poll shows the number of people saying they're not likely to get a COVID vaccine is declining. Good news there. Well, Mandy Gaither has the latest on the battle against COVID-19.
With COVID-19 cases continuing to climb, some U.S. hospitals are at a breaking point.
Delta is just ripping through the hospitals in ways that we couldn't have imagined.
In the South, where vaccinations have been lagging, hospitals have been hit especially hard. Alabama, Georgia, Texas, Florida, and Arkansas have only about 10% of their ICU beds left, according to the Department of Health and Human Services.
I had to turn away a cancer patient that needed emergency treatment simply due to the fact that my hospital didn't have any beds.
A CDC vaccine advisor says the hospitalization rate is 16 times greater in the unvaccinated population than in those vaccinated. And according to a new poll, the number of Americans saying they are not very likely or at all likely to get a COVID-19 vaccine has dropped from 34% in March to 20%, a new low in the survey. As for children,
the number of pediatric cases are increasing, and they are going to keep increasing.
The American Academy of Pediatrics is now reporting a 5-fold increase in the number of children testing positive from a month ago. But the number of parents who said they'd likely vaccinate their children has also risen by 12 points from 2 weeks ago. 68% of those polled now say they're likely to or already have vaccinated their children.